Do you struggle to get to sleep no matter how tired you are? Or do you wake up in the middle of the night and lie awake for hours anxiously watching the clock? If you have ever experienced the symptoms such as difficulty to fall asleep and stay asleep, wake up too early in the morning, or having unrefreshing sleep, you might be diagnosed with the insomnia, a type of sleep disorder. Don't worry everyone, because today this video will show you a drug that can be used to treat insomnia, which is Belsomra. The generic name for Belsomra is the Suvorexant. It is a prescription medicine for adults who have trouble falling or staying asleep. Belsomra is in a class of medications called orexin receptor antagonists. It works by blocking the action of a certain natural substance in the brain, which is orexin, that causes wakefulness. Belsomra is the only prescription sleep aid that targets and inhibits the action of orexin. It is the first dual orexin receptor antagonist, DORA, to be approved to treat insomnia. Unlike the benzodiazepine receptor antagonist, which acts diffusely on the GABA receptors and cause side effects, Belsomra is thought to act more centrally and selectively on the orexin system, thereby reducing adverse effects and abuse potential. Belsomra is taken by oral administration. It is available in 5, 10, 15, and 20 mg tablets. The recommended dose of Belsomra is 5 mg when used with moderate CYP3A inhibitors, and it should not exceed 10 mg in these patients. The recommended dose for Belsomra is 10 mg, taken no more than once per night and within 30 minutes of going to bed, with at least 7 hours remaining before the planned time of awakening. If the 10 mg dose is well tolerated but not effective, the dose can be increased, but the maximum recommended dose of Belsomra is 20 mg once daily. Orexin, also called hypocretin, is a neurotransmitter that regulates arousal, wakefulness, and appetite via their actions on serotonin, histamine, acetylcholine, and dopamine. Belsomra works as orexin receptor antagonist. It blocks the binding of wake-promoting neuropeptides, orexin A and orexin B, to receptors OX1R and OX2R that is thought to suppress wake drive. Belsomra may cause side effects such as drowsiness, dizziness, headache, unusual dreams, dry mouth, cough, and diarrhea. You need to tell your doctor if any of these symptoms are severe or do not go away. Belsomra may cause serious side effects including abnormal thoughts and behavior. Symptoms include more outgoing or aggressive behavior than normal, confusion, agitation, hallucinations, worsening of depression, and suicidal thoughts or actions. The other serious side effects including memory loss, anxiety, temporary inability to move or talk for up to several minutes while you are going to sleep or waking up, and the last one is the temporary weakness in your legs that can happen during the day or at night. There are a few important things you need to know before taking Belsomra. First, do not take Belsomra if you drink alcohol before bed, because it can increase your chances of getting serious side effects. Only take Belsomra when you can get a full night's sleep. Belsomra may be taken with or without meal. You may still feel drowsy the next day after taking Belsomra. And the last one is, do not take Belsomra with other medicine that can make you sleepy. I think that's all from me. Thank you.